Welcome to this week's episode. I am your host, Nicole Alfred. So, Cesarean Awareness Month is in April, and it was started by ICANN, the International Cesarean Awareness Network, who wants to bring awareness to cesarean deliveries and how frequently they're happening. I put my own little kind of twist on it. And I talk about Cesarean Awareness Month because I am a proud cesarean mom, but also because I do want to bring awareness around cesareans in that they don't have to be very stressful and fearful, and they can be very empowering. You can heal after. It is not something you have to suffer with for years, whether it's the emotional or the physical symptoms and pain. So that's kind of my twist on it. And there are women all over the world giving birth via cesarean delivery. 1 in every 3 women in North America are giving birth via cesarean delivery. And it is the second most performed surgery every day around the world. Like, that is crazy when you think about how many surgeries are being performed around the world every day. This is number 2. Like, what? And what's even more crazy is that this kind of lack of postpartum care, lack of postpartum guidance after having a cesarean for new moms when it comes to healing and recovery is not just a North American problem. It's a world problem. I talk to women all over the world, and there is not one time in the last 5 years that I've spoken to someone and they have told me that their hospital gave them a plan for recovery. It was literally like, go take care of your baby after 2 days of being in the hospital and then come back at 6 weeks. And the 6-week appointment is mainly just a birth control check-in to make sure you don't get pregnant too quickly. And that's it. And then they send you off, tell you to go back to regular life. So, it's crazy how popular cesarean deliveries are and how little information we have to emotionally prepare for them and recover from them. So that's my little take on Cesarean Awareness Month. But I wanted to talk to you about something a little bit more, something that you can maybe relate to. So what I want to talk to you about today is this idea of achievement. Right? Like, I talk to so many high achieving women, and I am one too, so I can relate. But there's this idea that, like, being a mom and doing all the mom stuff every day, like keeping your kids alive, feeding them, bathing them, caring for your home, caring for others in your home, animals, whatever it is not enough. It's not achieving enough. And so we have this like pressure, especially for new moms, like, you're adapting to having a baby. You're adapting to being sleep deprived. Doesn't matter if it's your first time or it's your 4th time. Sleep deprivation takes a huge toll on the body. And, this idea that we have to constantly be achieving something is really, I think, like a hugely North American issue. And it's the mindset. And that mindset of constantly having to achieve something comes from the fact that a lot of us are not going, to school and then having babies. A lot of us are going to school, having our jobs, our businesses, whatever it is that we're spending all of our time and energy and careers building up. And then we're having babies. And so we're used to kind of living our adult life as these like achievers and having big goals for ourselves. And so when you have a baby, it really makes you take a stop and kind of look at everything, because the day-to-day of taking care of a baby is very different than your role running a business or being in the corporate world, working at your job, whatever it is. And so the idea that we have where it's like, I constantly need to be achieving things, that ends up looking like for moms post-cesarean is trying to overachieve in areas that don't need you to overachieve right now. Because your job literally is to rest, take care of yourself, and take care of that baby. That is it. That is your job right now. And that is what you need to be focusing on. You don't want to end up in mommy burnout. Filling from an empty cup does not leave you feeling like you can be your best self. And you will take that out on your family members. They will feel it. They will feel the stress from you. And that's not the version of you that I know you want to show everyone. So the idea of having to have these to-do lists of like doing household chores or taking care of all the kids, whatever it is, make sure that it's smart, right? Do your SMART goals so that it's timely. It makes sense for your day or your week or even the phase of postpartum that you're in. It is okay to ask for help. It is okay if your spouse or your kids that are older or other family members, or even you pay someone to come and do some of the things that take up a lot of your capacity, a lot of your energy, a lot of your time. So just because you're at home doesn't mean that you don't have a job. Your job is your baby and your kids and whatever else it is, like recovering from your cesarean so that you can go back to work eventually feeling whole, so that you can take care of all your kids and raise them as little people, not feeling broken. Does that make sense? I really hope that it does, because I was having this conversation with a client last week, and it was this idea that like sometimes she just wants to do nothing, and sometimes she just wants to not be touched, and she doesn't want to talk to anybody, and she just wants to just put on Netflix and just kind of like just doze out, just kind of like not like zone out, just not doing anything. And I said, like, that's great. If you feel like your cup is full after doing that, amazing. She's at the 6-week mark where baby is napping a bit longer and kind of more slowly starting to get into a little bit more of predictability about when they're sleeping. And so if the baby's sleeping 30 minutes to 2 hours, those are her times to kind of throw on Netflix and just zoom out. And I said, that's fine. And if you can also add in some of that as like you getting outside, taking a deep breath, or you just kind of reading a book, or you not being on your phone, staring at nature, listening to nature, checking in with you. Because if you're on with baby all day long, constantly on, and then we pick up our phones and then we're constantly on our phones, and there's constant information, and then people call us, and then people come over, and then our relatives or our family members come home, at the end of the day. And it's like, we don't get these breaks to just like do nothing, think of nothing. And so I get why turning on a show can feel like you're getting some of that, but it actually doesn't. It's more information that's going into your head. So it's okay to do a little bit of that, but we also want to add in some of the other things. Not everyone's going to meditate. If you're into that, amazing. But just simply being out in nature, looking up at the sky, especially at night, like looking at the stars, like when is the last time you've done something like that for yourself? So I don't want to go into too much of a rant today, but I just thought it was important to bring up that like you don't have to constantly be raising the bar for yourself in postpartum, being this high achiever mom. You can be achieving enough by doing the chores in your home, taking care of your baby, and most importantly, taking care of yourself. You are the most important person to take care of, and no one's going to tell you that. They're going to tell you your baby's the most important, but that's not true. Because on an airplane, you're the one that has to get the oxygen mask first, not your kids. So what that analogy means is that like if you don't give to you first, if you don't make yourself the most important, you are nothing to anyone else, and you cannot take care of your babies. If you think about it, in olden days, you can't fight off the lion that's trying to come eat your baby. Right? You need to be healed. You need to be strong enough. You need to be full to be able to fight off and protect and, that sort of thing. And so you are the most important. You are the most important to take care of. You are the most important to consider, because the baby cannot survive without you. Okay. And so if you need to put the baby down in a very safe place in a bassinet or in a crib for you to take a break because they've been screaming all day, or they've been contact napping and you're like, I just need a break. That's okay. It's okay to do that. It's okay to take 20 seconds or 10 minutes and breathe and take a break. Okay. It doesn't make you a bad mom. It makes you actually a really great mom. If you are also into coming to live events, we are doing a C-section reset at the end of the month. I'm going to drop the link in the show notes. It's our 2-day event. I only do it once every couple of months, and we're going to be going over all the things that you need to be focusing on in your recovery to heal mind, body, spirit, everything, right? We're going to be helping you release that grief and trauma from birth, reversing that pelvic floor dysfunction, and then releasing that scar tissue. We're going to be talking about all of that and how you can do it. We're also going to have some really great opportunities to be able to work with me in there. And if you need further guidance, please check it out. The link is in the show notes. And I hope you have a great rest of your week. Take care.